I have an amazing opportunity to carry the legacy forward of my dad, who started this company in '56. I joined him in '86, took over in '93. The firm had clearly established itself as one of the premier healthcare engineers in the Bay Area, and to this day I still am remodeling buildings, with my dad's name on the drawings. But healthcare engineering was very different than when I joined in the '80s. So really, to stay relevant in healthcare, we've had to become a very different firm. And nowadays we're doing LEED for Healthcare Platinum projects, and locally a LEED Gold project for Highland Hospital. So we're definitely using different strategies and exercising different muscles in our delivery of our expertise. The healthcare sector as a business thrives on certainty, and that's a challenge right now. This industry chases the money. That's what they have to do. That's how they stay in business. So the question is, what signals will Affordable Care Act 2.0 set in motion that signal to the healthcare industry where the money is? There are trends that will continue regardless of what happens with modification of the Affordable Care Act, and some of those trends are influenced by the extremely high cost of building hospitals in California. Bedless hospitals are still, I think, the direction many healthcare organizations are going, where you only build in the acute care setting the functions that are absolutely necessary. We're also seeing healthcare, mostly under the encouragement of the Affordable Care Act, to be distributed to the community. So putting clinics in affordable housing is something that people are talking about, so that supportive services for very needy populations that actually stress our healthcare system are done in a way that lowers the cost, improves their care and hopefully their health, and is done in a much more cost-effective manner than bringing him into the emergency department, which has been the traditional sort of entree for marginalized communities. I think that we make two potentially key contributions in helping our clients realize whatever their vision is for a built facility. One is not being afraid to ask people to engage in conversations about things that have nothing to do with mechanical or electrical engineering. How is their patient population best served? What is, staff retention? Will it be, do they have a problem with that or don't they have a problem with that? Will they be helped by promoting, stress reduction among staff, patients, and visitors? So, knowing enough about the broad range of issues to be able to participate as a contributor to those discussions and encourage those discussions. Then, once we've sort of conceived of what the facility is, bringing our expertise in water efficiency, energy efficiency, the infrastructure that's unique to hospitals and healthcare settings, whether it's telemedicine or, imaging technologies or whatever the technology, because these are very technology intensive facilities, bringing our expertise to bear to be able to get those things designed for high performance, so low energy use, low water use, to be buildable and constructible, so to reduce the owner's risk of scope creep and cost creep. Those are all things that are part of making sure our projects are successful. We like to dream big. This is our dreams probably aren't going to happen next month, maybe not even next year, maybe not even in my time with Gutmann and Blavette. But it doesn't mean we shouldn't dream big and try to envision a future that can be much better. So, our dream is for hospitals, medical office buildings, and other healthcare built environments to be net positive energy, net positive water. Really to embrace the living building challenge from the aspect of health and healing. As we evolve and we realize that equity and social justice, that healthcare there are equity and social justice issues embedded in healthcare delivery systems in the United States. The value of beauty in the built environment and what it can do for healing And of course, the fact that resource constraints affect people in the community. So when people aren't drinking clean water, that actually brings people into the healthcare environment and imposes costs on the healthcare environment. So I think really moving towards regenerative healthcare facilities, net zero or net positive facilities that promote health and well-being inside the facility, health and well-being in the local community, and frankly contribute to global health and well-being, I think is a vision that we embrace.